Heart diseases remain the leading cause of death among Filipinos in 2022. What can Filipinos do to improve their heart health? Let's get advice from cardiologist Dr. Iris Garcia. Doc Iris, thank you so much for joining us on The Final Word. What are the common heart conditions among our kababayans?
Hi, good evening. There are a lot of conditions that can affect our heart health, but primarily it's exercise. It all boils down to exercise and diet, just the same. We have to make conscious health choices in terms of choosing the right kind of food, in choosing to exercise daily. What do I mean by that? Because when we exercise, when we improve our muscles, we improve its capacity to pump blood throughout the rest of the body. When we improve our dietary choices, meaning less cholesterol, more of the vegetables and fruits, we improve our overall health. So this is very important. Very basic yet very important.
Yeah, easier said than done, Doc, right? Because Filipinos love to eat unhealthy food. And of course, we need to see a lifestyle change to have a healthy heart. But why is there an uptrend, Doc, in the incidence of heart attacks among young adults?
This is something to do, well, most of the data that we have is actually from abroad, but it has been shown that the patients that are younger, that has the cardiovascular diseases are mostly those with comorbidities such as diabetes, also patients who have smoking habits, particularly marijuana, and also substance abuse like cocaine. This has been very evident in the studies that were released.
And what are the signs that may indicate that there is something wrong with one's heart, Doc?
Okay, for starters, when you do get, of course, chest heaviness, the usual, when we say in layman's term, parang mabigat na nakadagan, isang bloke na nakadagan, be wary of that. That's definitely one sign that you might be having a heart attack. For some, yes, atypical symptoms such as just shortness of breath, easy fatigability, or chest tightening, that could be also as an indication of a cardiac problem, particularly when this happens after exertion, like climbing a stairs or doing physical manual labor.
All right, chest heaviness, shortness of breath. But if you don't feel any of these conditions, should you always see your doctor to have regular checkups, Doc Iris?
Yes, it's very prudent nowadays. Before, we used to think that cardiovascular diseases usually just affect the older generation, older people, 50 and above. But as you've mentioned, we've seen a trend that even 40 years old and below have now been having chest pains, chest heart attack, cardiovascular diseases. We get patients coming in with coronary angiogram evidence of coronary artery disease as young as 26, 28 years old. So this is not, of course, this is very alarming, but it is happening. So it's prudent to do a regular checkup with your cardiologist or doctor.
Which foods and which types of diet are good for the heart, Doc?
As usual, and I'm sure you've heard this a lot from us, of course, fruits and vegetables. We can have 4 servings of, we recommend 4 servings of fruits and vegetables. A cup of vegetable would make 1 serving. A cup of fruit, juice, not drink, but juice, pure juice, of course, that's another serving. So this combined with, of course, 2 grams of salt or less, if possible. We want you to have less of the processed meat, like your canned goods. We want even the unprocessed meat as much as possible. The maximum, just take it for twice a week if possible. And of course, more of your fish, particularly the deep sea fish rich in omega-3. So that's very helpful for the heart.
What about maintenance drugs, Doc, for the heart?
Of course, if you do have elevated cholesterol levels, if you do have hypertension, it is very prudent and, of course, very, very advisable to continue this. That's why it's called maintenance. It means that you have to take this regularly. It doesn't mean that once you have controlled your blood pressure, you can now stop taking this medication. You have to continue taking your medications.
Thank you so much for this very important advice for our heart, cardiologist Iris Garcia. And you can get more health tips on Med Talk Health Talk, hosted by Dr. Freddy Gomez, with new episodes every Tuesday at 3:30 in the afternoon.